A mother walks into the clinic of a pediatrician along with her 3-year-old boy.
Doctor, Rohan has very high fever and he's very irritable.
Let's examine him and see. His fever is 101 degree Fahrenheit right now. Since when he has fever?
Since today morning. Is there a problem, doctor?
In reality, fever is actually good. Rising body temperature means that your child's immune system is doing its job by fighting an underlying illness or an infection.
What is the normal body temperature?
The normal temperature in children is about 97.5 degree Fahrenheit. However, it differs slightly from child to child. A child is considered to be having a fever when the temperature is over 99.5 degree Fahrenheit.
How would I know that my son has fever and needs treatment?
Well, you may consider that your child has fever if he feels hotter than usual on touching his forehead, back or stomach, feels sweaty.
Okay.
You must immediately seek medical advice if you notice one of the following signs which are suggestive of high risk for serious illness in children. Pale skin, lips or tongue, no response to social cues, does not wake or if roused does not stay awake, weak, high-pitched or continuous cry, rapid breathing with respiratory rate more than 60 per minute.
What should I do when the child gets fever?
Whenever you see your child is suffering from fever, you must undertake the following steps. Check your child's temperature using a thermometer.
Okay.
Remove any excessive or warm clothing of the child. Loosen any tight clothing. Ensure good air and ventilation. Provide plenty of fluids to compensate for fluids loss due to heat evaporation. And ensure complete bed rest.
Doctor, will fever make my child very uncomfortable?
Your child might feel uncomfortable due to the high temperature. He might have chills or shivering and might sweat when the temperature is falling. Sometimes mild dehydration also occurs if he is losing fluid as a result of the fever and not restoring it. Occasionally, fever can cause febrile convulsions, which are the most common type of convulsive events in infants and young children.
Doctor, what is febrile convulsions?
Febrile convulsions are seizures that happen because of fever. Febrile convulsion occurs in children between the ages of 6 months and 5 years. Febrile convulsions generally have no long-term consequences, but you should talk to your doctor about them.
What medications do we need to give to Rohan?
At the moment, I am prescribing medications for his fever. However, we need to investigate its underlying cause.
Thank you, doctor.
Welcome. Take care.